welcome to Sky's the Limit, and I'm your host Sharmeen Ali. Today we have with us Dr. Mohammad Osman Yusuf, who's a leading immunologist and allergy and asthma specialist in Pakistan. He's also internationally renowned for his work in this field, and he's the chief consultant of the Allergy and Asthma Institute of Pakistan. Dr. Osman has also been elected as a fellow of the Pakistan Academy of Sciences last year, which includes the top 100 scientists in Pakistan, and has some very internationally acclaimed scientists such as the Nobel laureate Professor Dr. Abdul Salam, Dr. Abdul Qadir Khan, and Professor Atta Rahman are amongst these as well. Also, Dr. Mohammad Yusuf has also published over 100 peer-reviewed publications and has had more than 25,000 citations, so his research work is renowned all over the world as well. So I'd like to now welcome to our program Dr. Mohammad Osman Yusuf. Thank you so much, sir, for being with us on our program today. It's a pleasure to have you here and an honor. Someone who's done so much work in the field and has been a pioneer in Pakistan.
Most welcome. The honor and pleasure is entirely mine.
Right.
And on a show of your caliber, it is an honor.
Thank you so much. That's very kind of you. So let's begin now, sir, with your background. I mean, you've grown up in Karachi, a very regular sort of life, and then you went to Rawalpindi Medical College, and then from there sort of things just took off, where you pioneered all these things in healthcare in Pakistan. So tell us a little bit about your life, your family. What kind of an environment did you grow up in Karachi?
I am very fortunate to have come from an educated family, and that really helped me a lot. My father was a banker by profession, and at the time when Pakistan was created, the Habib Bank gave a loan to Pakistan government to set up the country. My father was the officer responsible for that loan, so he was the banker to Qaid-e-Azam. And later on his banking career grew. He was the head of several banks. He was acting governor of the State Bank of Pakistan. Later on he established a bank in Islamabad called the Federal Bank for Cooperatives.
Okay.
But he is also, his field was microcredit, and the famous Grameen Bank of Bangladesh is something that he helped set up, which is a Nobel Prize winning.
Absolutely.
So I'm fortunate to have come from a family like that.
Right.
My elder sister was a gold medalist doctor. My brother was an architect, and he is also very talented. Unfortunately, none of them are alive anymore.
Okay.
So I was the black sheep in the family. I was naughty as hell, and I loved playing pranks.
Okay.
And I was never a topper in my class. And I remember in one of my earlier television shows, I got a call, a live, a lady called asking that I should advise her son to come first in class. And I remember I turned around and I said, "Beta, kabhi first nahi aana, don't ever come first, because the people who come first don't really achieve much in life." Anyway.
Why would you say that? I mean, just can you...
Because they're too academic. I think the people who are more practically inclined, the people who are more street smart, who know what's going on around them, actually I think they do better in life than the ones who are just bookworms.
Right, yeah, I can cite a few examples of those kind of people later on, but
Right.
you were also very active in the Boy Scouts.
I was. I helped establish the Boy Scouts in the Karachi Grammar School where I studied. What I did at that point in time, because I had a very sort of deep desire to develop Boy Scouting at that point in time, I went ahead and did many proficiency badges, which normally no one had done before. And you get those badges when you do things like handicraft and woodwork and all sorts of things. So once I got those badges, they weren't available because you can pin them on your uniform. So I embroidered all my badges myself.
Wow, okay.
So things like that. Anyway, I was then the first Qaid-e-Azam Scout, which is the highest rank of scouting in Pakistan from the school. It was awarded by the President of Pakistan at that time. So that's my interest in handicrafts.
Incidentally, I was a Girl Scout as well in New
Wow.
York when I was a kid. So it is a lot of fun, and it really engages you a lot and teaches you a lot of things.
It does.
So then you end up in Islamabad, and you went to school over here for a bit, and then went to Rawalpindi Medical College.
I did. And at Rawalpindi Medical College, I was again not what you would call an outshining or or a medal holding student. I was just average or maybe slightly above average. But I finished my MBBS in 1985, did my internship in Rawalpindi at the district headquarters hospital. And then, as luck would have it, despite having qualified the Punjab Public Service Commission exam, unfortunately in those days you needed a recommendation from high up, which my father refused to provide. He said, whatever you're going to do it on your own.
Sure.
So I ended up with a job at the National Institute of Health in Islamabad in Jan 87, because apparently nobody else wanted jobs like that, because those were research jobs.
So your father saying do it on your own and not helping you at that time, did you think that benefited you, or was it a setback for you? Because this is something that's prevalent in Pakistan. Everyone feels they have to go through someone to get somewhere. In your case, do you think that helped you or it went against you?
Oh, I would say it helped me very much, because now by the grace of the Almighty, I'm ranked among the top 1% specialists in my field in the world.
And the reason for that is you have to do it on your own.
I think it basically put me on a line which I was not expecting. I didn't even know it existed. But then, because I liked it and it sort of went with my Boy Scout type work, lots of handiwork, stuff that you're doing with your hands, it helped me to go ahead in my field. And one thing which my superiors and my seniors taught me was, if you want to be a good supervisor or you want to be a good scientist, you have to learn to do things with your own hands. Don't rely on technicians, don't rely on others. If you can do it yourself, then the sky's the limit.
Okay, so so you kind of shifted course when you faced that obstacle. And all right, so then you worked in the National Institute of Health. Before you went abroad, you were working here. Okay, tell us about
So there I was in the Department of Immunology. And immunology is one of those subjects that you actually don't study in med school, because you know there's not going to be a question about it. Anyway, so then it sort of fell on me and I had to study, and I liked it. It was a fantastic field. I loved it. And when you like your work and your work becomes your hobby and your passion, it makes it easier for you to excel in whatever you're doing.
And can you elaborate a little bit about immunology? This is about your immune system and how to fight diseases and all.
It is.
Why would that be something you don't really study in med school? Isn't that what it's all about?
It is, but not in so much detail. I mean, you know about it, you study about it, but unfortunately a lot of people have this concept that they study more for the questions which are more common for the exams rather than study to learn. And I'm just saying that that's a hypothetical statement. Majority of people do study throughout, but perhaps I might have been one of the lazier ones.
Right.
So immunology, yes, you're right, is the study of the immune system of the body, but then the diagnostics for that is something which has not developed too far back. It's all very recent. So it was very challenging to come across a field which does not even exist in Pakistan. So the immunology department at the National Institute of Health back in 1987 was the only department of its kind in the country. So it was fun to start working with machines and equipment and things which, you know, having sort of a technical incline, they seemed very attractive to me. And I was able to develop many diagnostic techniques which were not available in Pakistan before.
Such as, can you give us some examples?
One was for infertility. There's an immunological infertility in which people cannot conceive because they do conceive, but their own antibodies then sort of knock out the embryo which has been formed.
Really? Okay.
Or you know, like for example, they immobilize the sperms, they have other things. So those were things that we were working on. Then we looked at autoimmune disorders and developed a technique known as fluorescence, which was not previously available in Pakistan. And I remember having gone to places like leading institutions, the Aga Khan Hospital, Karachi, Lahore, Allama Iqbal Medical College, set up the equipment there, just out of pure interest of these things.
Autoimmune disorders are diseases such as cancer and lupus and things.
Exactly, even arthritis. It's where your own body starts fighting against your immune system starts fighting against your own body.
Okay.
So it doesn't recognize many things as foreign. It thinks that your own self is foreign and mounts an attack against. It's like a little civil war in your own body.
Okay.
So I worked on that. We developed the diagnostics for rabies and things like that.
Okay.
So we were all doing this. While this was happening, Pakistan saw its first HIV/AIDS case in January 1987.
Right.
That was a African sailor. He had come to Karachi, and AIDS was a new thing at that point in time. It had just been discovered in 1985 that this is a disease which knocks out the immune system. So I was able to have gone to Karachi and seen that first patient. He died a few days later.
Okay.
But then a couple of months down the road, the World Health Organization decided that we needed a reference laboratory in this region. And as luck would have it, I was there. So I was trained for that, and that's where my career in HIV/AIDS took off.
Let's talk a little bit about this. I mean, you worked as a consultant on HIV and AIDS with several UN and international agencies, and that too at a time, like we're saying, when this was relatively new in Pakistan. And we also know that at that time, the topic was pretty taboo, and it wasn't really talked about. STDs, sexually transmitted diseases, is something that nobody spoke about. And people were really sort of looked down upon and discriminated who may have had this. So they probably didn't even go and get themselves tested or announce to anyone that they had this or even get treated for it.
That's very true. That's very true. So at that point in time, the government of Pakistan launched the National AIDS Program. So there was a WHO AIDS program and there was a National AIDS Program. And that focused exactly on what you're saying. It started off as a screening and surveillance program, and basically the first couple of, well, first few hundred patients that we had in Pakistan were people, Pakistanis, deported from other countries because they had been HIV positive.
Like Middle Eastern countries.
Exactly, because they do their screenings once a year, so anyone coming out positive was deported out. Now, the taboos and the problems which started, but once these deportees came back to the country, obviously they were hotbeds of infection to spread to their wives, to any other partners they would have, to their families, children, through blood transfusion if it was women.
And pregnancy can pass on to a fetus, right?
It can do, but the point is that majority of the workers were males. So they'd infect their wives, and then the wives would infect the children. And that's how it started to spread initially. It wasn't a blood-borne spread in the earlier days. But after that, there was a lot of infiltration of HIV positives coming in from the Afghan refugees at that point in time. I mean, I distinctly remember this story of a young lad. I could take his name, but I don't. He's a beautiful, gorgeous-looking young lad, about 14 years old. He used to live in the railway tracks of Rawalpindi, of the Rawalpindi railway station. And he would be sexually abused every night by laborers, and he would get money and all. So the first time I saw him was in my internship, and he had big lymph nodes on the sides of his neck, and I sort of suspected that, you know, this could be HIV/AIDS. HIV infection. The AIDS had already developed. So we sent their sample for testing, and then his sample turned out to be positive. Again, that young lad died a few days later because we didn't have therapies at that point in time. But this is how the problem spread. There was a lot of stigma. You're very right about it. I remember a family, one of the deportees, he was near Thokar Niazbeg in Lahore, and news spread that he's HIV positive, and I think his wife became HIV positive because of him as well. Because of that, his entire village got together and they went to burn his house down. They tried to kill him, but fortunately, by chance, because we'd gone to investigate, we had a slightly larger car. We'd been sent. I had started my work at NIH at that time. We had a slightly larger car provided by the health authorities in Lahore. So we were able to put that whole family in the trunk of the car, put a blanket on top of them in sweltering heat, but we drove off with the family.
And saved their lives.
Saved their lives, but the house got burnt down. In other case, a family was thrown into jail because of being HIV positive. And if I can actually narrate an incident which you might find interesting. One of the first cases ever the first cases ever diagnosed of HIV infection was a gentleman who had come from the US, and he had thrush, oral candidiasis in his mouth, white patches. And it was picked up by a dentist in Karachi. The dentist wanted to publish that finding, and obviously I think he did publish it, and the news got to the head to the big brass at the National Institute of Health. And myself and my senior officer were deputed to Karachi to go and request the dentist not to publish this because it would create panic and scare in Pakistan.
Right. And then what happened?
The dentist turned out to become the president of Pakistan today. That's Dr. Arif Alvi.
Right.
So he has the credit of being the first dental surgeon in Pakistan to have diagnosed the first HIV/AIDS case.
Wow. And he wanted to bring awareness about it.
And he wanted to, and he published. Obviously, he was right, but what he was not aware of was the absolute negativism at the central level of the denial and everything. So that was very bad, and
that's something President Arif Alvi gets a lot of credit for, being very socially aware. Even now as president, the issues he brings up are always something that are at the forefront of what needs to be addressed.
That's true.
Population control, breast cancer awareness, etc. The list is endless. So we appreciate that about our president. So that's a very interesting case, definitely, for sure. And now, Dr. Saab, what is the situation in Pakistan regarding HIV and AIDS? Has it been dealt with properly, and it's been brought under control since that time?
I am really sorry to say that I don't think it is at all.
Oh, really?
Because the problem is there has been a lot of money in the National AIDS Control Program. The management has not always been the best as it should have been. And there's been a lot of, again, denial, and there's been a lot of corruption. Like, I don't know if you're aware, some time ago there was an outbreak of AIDS in children in Sindh, which was caused by using infected needles. Now, there's a lot of uproar these days about that those cases should be investigated and things like that, but no one is taking the top brass, the management, into accountability, because it was the responsibility of the National AIDS Control Program. There was a National Blood Transfusion Program also in place, it still is, and these are really well-funded programs. So there's no justification for them to have neglected their duties. Unfortunately, health has devolved into a provincial subject.
Yes.
So the AIDS Control Program, which had direct control till I think 2018, now has to go through the provinces. But no one's actually taking the managers into accountability for why this happened. Everyone is blaming the doctor who spread it through the needles. But if he was not aware, or if the government did not provide him syringes, which they could have, so I don't think it's only the doctor who's the one to blame for this.
Right. So in that regard, okay, better management is needed, but the social awareness has increased about this topic in the sense that it's not social taboo anymore as much. It's not such a stigma anymore.
True.
We're talking about it on national television.
True.
Issues such as child sexual abuse, which transmits this on a large scale, that has been brought to the forefront, thank goodness, because that was also something never discussed back when you started work on HIV and AIDS. And then there's all kinds of subjects that are coming to the forefront, such as the rights of transgenders, etc. So Pakistan is becoming a lot more of a socially aware society than it was back in the 1980s.
Oh yes, oh yes. I totally agree. I remember back, I don't remember the year, but one of your senior most producers had produced a lovely program on this, which was being led by the famous poet Ahmad Faraz, and Ms. Farkhanda Shaheen, I give her all credit for that. A beautiful program, very well planned, had lots of leading experts, but never could get permission to be aired. Because at that point in time, you couldn't talk about these things.
Right, exactly.
And I would give credit to the media as well. They've been very responsible about it. And a lot of the media personnel who are actually reporting on health, they have never tried to create sensationalism out of this. They've been very positive about it, and they've actually spread the message the way it should have been. And then, of course, with the government coming in, and especially the present government, giving transgenders the rights, now they can actually have their own ID cards and stuff. Well, I've worked with a lot of transgenders, and in red light areas in Pakistan, with intravenous drug abusers, with truckers, and people, how HIV has been spreading throughout the country. And I've worked in the field, even after I stopped being with
through maybe prostitution and things like that,
yes.
it's been spreading as well.
I remember this was a very funny story. I went once to Hira Mandi in Lahore with my uncle. He wanted to see the place. So we went at about 11 or 11:30 in the morning, daytime. And I started getting shouts from, oh, Dr. Saab, Assalamu alaikum, hello, Dr. Saab. And my uncle looked at me and said, God, I don't know what.
Right.
But we established a clinic in Lahore, in the Hira Mandi, one in Napier Road, which were basically, they were STD clinics, but with a front of either a ladies' health clinic or a child welfare clinic or something like that. And that's how we started work, so that at least, the communities, the high-risk communities could be sensitized.
Absolutely, and that's how you curb the spread, by addressing those high-risk communities. So then you got a Chevening scholarship, and you ended up in Birmingham. Tell us about that as well. How was that experience, and how did that sort of develop your career as, in your profession, and how did that sort of expand or change your thinking and maybe change your course for the future?
Thank you very much. Well, I was lucky because the Chevening scholarships offered at that time were not for doctors. But because of my HIV/AIDS background, the way I had written it up, I was selected. I was lucky for that. I went to Birmingham because the immunology department at NIH had been established by the Birmingham University teams. So, I didn't know anyone there, but I felt I would be more comfortable. And once I reached there, unfortunately, there wasn't a focus on HIV/AIDS, but they did have one of the best allergy departments there in the UK. And the supervisor I worked with was the president of the Royal College of Pathologists and was the WHO's head of allergy, Professor Ronald Thompson. So I worked with him, I trained with him, I completed my master's, and unfortunately, I was enrolled into a doctorate as well, but unfortunately my mother died the day I was having my final exams, and no one told me about it. So I called home after my paper to say that, I've finished my exams and I've just got my vivas, and there was absolute silence in the house. So I spoke with my wife, I spoke with my father, and I finished the phone call, and that was it. And I thought, why is it so silent? Apparently my mother's janaza, her funeral was lying there, and everyone put their fingers on their lips so that I would not know. And when I finished my exams and everything, about a week later, then I was informed that she'd passed away.
Oh God.
So then my father was alone, so I just wound everything up and I came back to Pakistan. I left my doctorate there, which I later completed in 2001. So I was able to get that.
So then you returned here and you started working for PIMS, Pakistan Institute of Medical Sciences.
Yes, I was invited by PIMS, and I was very fortunate to go there because I had previously co-supervised 2 students for their MPhils on immunology. One was doing his MPhil on breast cancers, the other one was working on kidney diseases. So I had a little bit of a background of working in PIMS. So I came to PIMS in 1993 and established the immunology department there. This is the first ever immunology department in a hospital. And the then executive director of PIMS, Dr. Ghayur H. Ayub, he asked me, can you set up an allergy department? And I looked at him in the face, I said, sir, done.
And this is in 1993. It's that late that we started an allergy department in Islamabad, where allergies are so rampant. Well, and you were the person who started it.
Not really. The allergy department had been established at the National Institute of Health by General Burney in 1985 as an experimental department. Unfortunately, that experimental department did not proceed very much. I mean, they make claims, but they're still doing stuff which they were doing back in 85. They never really progressed. This department became one of the largest departments in Asia. It was the 3rd largest, reportedly. And with that, then we started researching, and that's when in 1994 we actually were able to diagnose the cause of the pollen allergy in Islamabad.
The paper mulberry.
The paper mulberry, that's when we found that out. Then we looked at other factors and we found that cannabis, the local bhang, cannabis pollen also causes allergies in the rainy season. So as a trial, well, because I was head of department at PIMS, we had the cannabis plants tracted and raised to the ground in sectors F7, F8. And then we did a pre and a post study, and we found that allergy in the spring, in the rainy season, went down by 80%.
Really? And
So-
nobody really perceives the rainy season to be a high-risk time for allergies. They think that the dry season and April, when you have the
Yeah.
pollen is
Of
high,
paper mulberry.
or
Yeah.
paper mulberry, they think that's allergy season. Then the rainy season starts and people are not expecting to have allergies at that
Exactly.
time, but it's there.
It's the,
So
but the
it's due to the cannabis part.
it's due to cannabis. But the difference is, paper mulberry trees all flower at the same time. So their counts go up to 30, 40, and this year it went up to 44,000 grains in a cubic meter. That was really bad. Cannabis, you'll have a plant flowering now, you'll have another one flowering after a week, one after two weeks. It'll die down after the rains, it'll come up again afterwards. But so there's never really a very strong peak, even though that's a very potent allergen. But other than that, I mean, our work in Pakistan, we found we have the allergy to wheat threshing dust. It affects all of central Pakistan. The paper mulberry allergy problem, we found that to be a big problem in Hayatabad, phase 3 in Peshawar. We found it in Burhan and in Hassan Abdal. We found it in Mirpur Azad Kashmir, in Sialkot. I mean, there are pockets of this. And why? Because it's where people have cleared the natural plantations and allowed the paper mulberry trees to grow, because that comes very quickly. It's an invasive plant,
Okay.
and it stops other plants from growing as well. So having a clean ground is a death warrant for paper mulberry allergy patients.
Right.
So
Okay.
as long as you have natural foliage there, it won't let the paper mulberry overgrow. So if you look at Islamabad, it's very interesting that there used to be no paper mulberry towards the Margala side of the Margala road, but there was lots of paper mulberry where you had construction on the F6, F7 side. But now, since they've been cutting down trees on that side as well, so paper mulberry is gradually extending. Similarly, you never had paper mulberry trees after 0 point. But gradually, since all these colonies have started coming up over the next to the expressway and after the airport, old airport turning, it's gradually increasing because you're giving it land to grow.
And also, cannabis grows very wild over
Yeah.
here. And are these being removed at the allergy season time now?
Not at all, because people don't recognize cannabis, like you rightly pointed out. But cannabis is all the way from North Pakistan, from Hazara, all the way down to Sakhar, and it grows along the river Indus. So it's a much larger problem, but people don't recognize it.
Right, and Dr. Saab, another thing that I don't know, it's my observation, I'm not a doctor, so I would like to ask you, I have a background in environmental sciences, the pollution levels in Islamabad due to vehicle emissions, maybe we don't have that many factories, and yes, it rains, but does that contribute to the worsening asthma and allergies in people at the moment, do you think, in your opinion?
I think we should work on this after the interview. I am currently the principal investigator for a University of Edinburgh research project funded by the UK government, in which we're looking at environmental factors on allergies and asthma. So we're looking at the air pollution, the PM 2.5s, we're looking at ozone levels, the temperature, humidity, and everything to see how it affects the pollens and causing asthma. And what we're trying to do is develop an app so that patients who are actually allergy patients can download the app and they can register their complaints, and they'll get a message a couple of days before that particular level of pollution or humidity or pollen is going to come, so that they can start their preventative treatment in advance.
Okay, that's great.
So we're working on that. We have a similar parallel project working in Malaysia, in which the wood fires from Indonesia, as you know, they've been causing rampant asthma in Kuala Lumpur and those places. So they're working on wood fires. We're working on asthma because of pollution. So yes, you're right. There is this, and for this, when Hamidullah Jahan Afridi was the Minister for Environment, he invited me to be an advisor, and we set up the first ever national program for asthma, which was joint between Environment Ministry and Ministry of Health, and I was the national coordinator.
Okay.
But then with devolution and everything, we lost that. But that was looking exactly at the effects of weather on asthma and respiratory diseases in Pakistan.
Right, and especially in the cold season, then when
yes.
it's very dry, you see a lot of deaths of elderly people and a lot of
Yes.
young children getting very sick and having episodes of these kind of respiratory illnesses. That's just as an observer, I'm saying. I'm not a doctor.
You're
but
right,
you would know
and
better.
smog, and smog.
And smog, exactly.
Smog has come up as a new problem which we never had before.
Right, right. And also in Pakistan, we don't really have many scientists in the field of epidemiology, do we? I mean, that would be helpful to know what's causing what outbreak where, right?
No, I think we're getting better. The NIH established a very good Department of Field Epidemiology Research Unit.
Okay.
And they have been working. Dr. Jawad has been very instrumental in that, and he's done a lot of work over the last couple of years. The Health Services Academy has produced a lot of epidemiologists. Some of them were actually working practically in the field.
Wow, okay.
So yes, Pakistan is actually now coming up to that mark, if we're not already there, I think.
Okay, that's very good news to hear, because that is very important, right?
It is.
So
It is.
then in 1996 you established the Allergy and Asthma Institute,
Right.
which is right now what you're heading as well. You're the founder of that. You're the chief consultant over here as well. And this is something you've had your ups and downs in this as well. Would you care to share that with our viewers so they can also see that everybody has difficulties in whatever work they may be doing?
Thank you. In 1996, we had a change in government, and we had a temporary Prime Minister, Mr. Moin Qureshi, who had come in Pakistan. As soon as he took over, one of the things which one of the rules he made was that all deputationists should go back to their parent departments. At that point in time, I had just established institutional practice in PIMS. So doctors would actually do their private practice, but also do it in PIMS so that the hospital would also benefit. Anyway, so when he came in 96, I was transferred to an administrative post. And I thought that this is not the life for me. So I left that, and that's when I established the Allergy and Asthma Institute. It was a small setup to start off with, but then as the years went by, we had branches from Nepal to London, and we set up a clinic in the Middle East, in Dubai. I was appointed as the vice chair of the Dubai Abu Dhabi Health Authority's Committee on Allergy and Asthma. I set up their first allergy clinic. Then I set up allergy clinics in Bangladesh, in Sri Lanka. So I had that honor. So that has been a journey which, we did a lot of research on allergies basically, and had our own research laboratories, and were developing new allergens and new reasons, not looking at treatments, but looking at causes of allergy in the region. So that was the work we were doing.
Right, okay. And then for a while you left Pakistan.
And then for a while I had to leave Pakistan, unfortunately. In 2014, from 2009, you may be aware there was a lot of insecurity. A lot of doctors left Pakistan at that point in time.
There was a security situation.
There was a security situation. There was harassment by the tax people. I know so many people who would have 5 patients in a day, but they were told that no, you have 25 patients, so either you pay us, or things like that. So I didn't want to get into that. And then unfortunately in 2014, my daughter was working near the city courts in Islamabad. So they had the attack on the city courts in 2014, and some of the judges were attacked and everything. So she narrowly escaped that time. So I decided it's not worth staying here, because if your family is at risk, it's definitely not the place to be in.
Right.
So we donated our entire research department to the Quaid-e-Azam University. We just sold off whatever we had and migrated to Canada at that point in time. Unfortunately, I would say, or fortunately, because I have over 100,000 patients, we have a very large patient base. 6 months later, I was back in Pakistan. My family was there, but things were we were maintaining a very low key, and fortunately, we established everything all over again.
And you're back. So fortunate for us that we've got you back now. And this does tend to happen with people. There was a time when people were afraid of the security situation, but now a lot of people have returned as well. So Now, you're also leading a lot of research with the WHO and with the UK government in Pakistan concerning allergies and asthma, and a lot of preventive research that you're doing for these illnesses. Can you discuss that a little bit, because it's very important? This is something that would be very beneficial for our viewers, especially right now with the COVID-19 situation. It's also asthma allergy season, so people have like a sort of double whammy going on with their health.
True.
Right.
That's very true. I'm not working with the World Health Organization so much. I am the national representative for the Global Alliance on Respiratory Diseases.
Right.
And I had the little projects that we do in different places for chronic respiratory diseases. One of them used to be, we used to set up a free pollen allergy camp with the chief commissioner at the Appara Community Center. You know, small things like that, health camps in different places. My last project that I did for the WHO was a project on HIV, AIDS and tuberculosis. But because we couldn't get enough patient recruitment, we had to drop that. So my main focus now is on allergy asthma.
Okay.
And what I'm doing for the United Kingdom's National Institute of Health Research through the University of Edinburgh, they have a project called Respire. And that is basically looking at developing health resources in low and middle income countries. The main focus these days in Asia is Pakistan, India, Bangladesh and Malaysia. I've done one project for them which was looking at chronic respiratory diseases in our region here. That was a 5-center study in India and the other countries as well. What I'm currently engaged in is the air quality project that I mentioned to you earlier about the environment and allergies. In COVID, we're looking at research on washing, nasal washing, as a treatment for COVID infection, or rather coronavirus infection. Coronaviruses are a whole family of viruses, of which SARS-CoV-2 is the one which causes COVID.
Okay.
So what we're looking at is if you can wash your nose frequently enough with strong salt water solution, it actually kills the virus. And we're doing that as a comparison with wuzu, because in wuzu you're also washing the nose but not using salt. So that's a study in which we're trying to recruit people. It's a simple nasalwash.pk is our website.
And there's a way of doing the nasal washing.
There is,
there's a proper technique. It's not just you just,
it's
you
not
know.
just using.
Yeah.
So nasal washing is phenomenal. The way we do that, we recommend that, is simply take a glass of water, or clean water, which has either been filtered or distilled water or anything clean, the one that you use for drinking, and put in as much salt as you can tolerate comfortably. Then all you do is use a simple device. You can use either a syringe, remove the needle, fill it up with the water, just simply put it in one side of your nostril and press it, and the water will flow out of the other side. Even if it doesn't flow from the other side, it will flow out from the first side, from the same side. It will clean everything and give us salt coverage, which would really make a difference, because salt is an anti-inflammatory, it's an antibiotic, and it's an antiviral. What we then developed was, we worked slightly more on that and developed a nasal wash bottle. Now this is very similar to the bottles that you will get abroad as well. But we changed the diameter of the tube inside and used that with a smaller bore to give a cleaner wash, which is non-irritating. So you fill it up to the mark with clean water and put in either salt, or put in a solution of 1 part salt or 2 parts salt and 1 part of baking soda, sodium bicarbonate. Put it in one side and just squeeze it. Do not breathe it in, do not suck it in. It's very easy to do. Just squeeze them from one side and you'll find water coming out from the other side. And do the same from the other side. And after that, just gargle with the remaining salt water.
And this, you would say, prevents COVID and other infections by what percent, in your opinion, like from what you've seen?
We've used it in all the patients who we've treated for COVID, for asthma. And the statement given to us by patients, asthmatic patients, is that their life is changed. It's a life-changing experience. It's so powerful. In COVID, we found it to be very effective. But what happens is that obviously, if it's not done frequently enough, the study we're doing now, we're recommending at least 12 times a day. because the virus replicates very fast and you have to knock it out before it divides again. So in normal cases, the viruses, they divide in about 3 to 4 hours. The coronaviruses take 20 to 40 minutes and they can start dividing again. So you need frequent washing for this.
Okay. And otherwise, for regular allergy patients, it's how many times?
3 to 4.
3 to 4. Okay.
4 we recommend in allergy season. 3 times we recommend for asthma and other allergy patients, 3 times a day.
One concern that people may have is that someone said that if you put some liquid in your nose, it can go into your lungs. Would you say that's a concern, that could happen?
How many times do you drink a glass of water? It never goes in the lungs.
Okay.
So the nose is connected to the throat, and God has given a mechanism that if it even starts going towards the lungs, you're going to cough out bad.
All right.
So people have this misconception.
Yes.
So it'll only go to the back of your throat at the most, but when you're doing it like this, it'll go in from one side, either come out from the same side or the other side. And because we're speaking of asthma, I'd also like to take a second to talk about how to deliver inhalers. You should be perfectly okay to do that. Now, usually the curative ones are blue in color.
Yeah.
Always remember that you have to shake the inhaler very well, at least 10 times, otherwise the propellant goes separate and you only get the propellant gas and you don't get the medicine.
Okay.
And what we've developed is a simple bottle like the bottle available in other countries, but we don't recommend the small bottles because this bottle, if you hear it tick tick, you can hear the sound, has a little valve in it. Now this valve has a principle that works similar to if you've ever seen an F-16 take off. You have the thrust and then the nozzle sort of gets constricted and the thrust pushes the plane forward. So this has the same principle. So you shake the inhaler, put it in the back, and once you've done that, then all you're going to do is put it in your mouth, blow out once, puff it as many times as the doctor has advised, and then take a deep breath in and hold it. So you puff it out, and hold it as long as you can. I've puffed extra puffs so that you can see the medicine going in, but once you've taken it in, believe me, I have hundreds, thousands of patients, we have them on video. They're coughing, they're wheezing, and by the time they release their breath, their eyes go around and say, "Doctor, what have you done?" And their breathing dilates. This works faster than a nebulizer with tons less medicine because that is in milligrams, this is in micrograms. And here the medicine is just going where you need it.
Right, okay. So as far as the vaccine myths are concerned and the fear that people have of getting vaccinated, would you like to debunk those right now? I mean, are we being tracked by Bill Gates with some microchip in our arms and things like that? People are saying you can attach a magnet, and some people are putting a light bulb and saying see it glows. So what would you like to say about those videos going around on social media that are actually scaring people? And the latest report, one of them saying that within 2 years whoever's vaccinated is going to be dead. What would you like to say about that as a doctor who's treated over 1,000 COVID-19 patients and who knows about the vaccines now being delivered? What is your opinion on that?
You're very right in this because there's so many misconceptions in our society all over the world, because misconceptions and rumors, they spread like wildfire, proper information doesn't. I'll go backwards according to to your question. Professor Luc Montagnier, who has been accredited for the statement that people will die after 2 years, he's a Nobel Prize winning scientist. He's the person who discovered the AIDS virus, and I've worked with him back in the late 80s, 90s. He's a very gentle soul, and he would never ever create sensationalism. And this I say from having known him personally.
Okay.
What he did say was that the amount of variants being produced and the vaccination being done, it may be 2 years by the time when we may need another set of vaccinations to be, or the vaccine to be changed. Now that's nothing to be worried about, because in the influenza vaccine, for example, every year you have a new vaccine. When you buy the vaccine, it gives you your year and is only valid for that year, because by next year it will have mutated again. But our people, or unfortunately people, only take half the news and they spread that. And I'll give you an example. You may find it slightly unrelated. Even if you read the Holy Quran, I can prove to you that in the Holy Quran it says there is no God. Because it says very clearly, La ilaha, there is no God. Full stop. If you stop there and you don't read the rest, which is except Allah, you have actually, you can prove anything you want by reading only half the statement. And that's what's happening. People only read half the news, or they only have half the knowledge, so they go around spreading stuff which is wrong.
Okay.
The other aspect regarding the other vaccines, the magnets and the electricity and the people lighting up a bulb and all that, honestly, I have no idea where that came from. The only thing which which I thought might make a difference, that there might be a small quantity of alum inside one or two of the types of vaccines being manufactured in United States, but not the ones that we have here. And that till it disperses, like, because many vaccines are alum based.
Okay.
Alum is a stabilizer for the vaccines.
Okay.
Our measles and polio vaccines, and I'm not sure which ones are, which ones aren't, but some. So that could be one reason.
It's not the microchip that they're saying has been implanted in.
In any case, if you take out the chip from your mobile phone and put it with a magnet, it won't stick.
Okay.
Okay, so it's not the microchip at all. The biggest reason that we're having these myths is because people are ill-informed. We had the same problem with polio in the polio campaign, that it's going to cause infertility. We had the same problem when rice was being imported from the US, that the rice is going to cause infertility. I mean,
everything is a conspiracy.
It is a conspiracy theory. So it has absolutely nothing, because they're nothing to do with it, because they're two totally different
so
systems.
the stories about the vaccines causing infertility in young girls or men, that even you would say is not correct.
There's no connection. There's absolutely no connection. I mean, if I was going to say that the rainfall in Zimbabwe is going to make us wet sitting in Islamabad, there's no connection.
Okay, that makes absolute sense. And now also you had mentioned low-cost tests. That's very important in Pakistan, because there's another myth going around that this is something that's only affecting the affluent classes, and that's probably due to the fact that lower income people aren't able to afford the current PCR testing, which is 8,000–9,000 rupees.
True.
So the low cost testing will then be available to everybody, and then we'll get an idea of the actual numbers also, right?
And also because of the denial, a lot of our people now who have frank COVID symptoms do not go in for testing, because either they're not confident in the test, or they cannot afford it, or simply they're going to go and borrow someone else's prescription off the internet, or from this doctor gave this prescription to so-and-so, so I'm going to use the same thing. So there's a gross amount of under-reporting going on as well.
Right, and then they're not getting proper treatment due to the fact that they haven't been tested. And now, as a final message to our people, we've pretty much overcome the third wave here in Pakistan that we're seeing. There were a lot of fears about the Indian variant coming and us having a similar situation to our neighbors, which is very unfortunate what they've had to go through. And luckily, we have not had to go through that same extreme level of devastation. What do you think saved us from that? And secondly, going forward, because this is a virus that doesn't seem like it's going to be going away, it's here to stay. Where do you see this going? How do we live with this now going forward?
That's very, very important. And because you mentioned the Indian variant, there's been a lot of talk about the black fungus. I'd just like to just say one word.
Sure.
The simple fungus that we get if we leave a slice of bread outside, the black fungus is the same black fungus. Okay, so it's not something which has come from outer space. It's only because people have low immunities, because of diabetic people being pumped with extra steroids. That's why it affected them. Our doctors in Pakistan know very well how to treat it. It's very easily treatable.
Right.
And I would say that because of better control here in Pakistan, steroids have not been used as indiscriminately as they have been in India.
Okay.
As far as the pandemic is concerned, my hats off to the government, and all praise to the government. No matter how much you praise them, it's not enough. The smart lockdowns, the responsible way that the government has behaved, especially our vaccination campaign is probably one of the best in the world. People do rank it. I mean, you send a message to 1166 and you get a code, And even if you don't get a code, you go get
And
yourself
it's
vaccinated.
very thorough and systematic.
It's very good.
Systematic.
And the vaccines, that is one point I'd like to talk about, have been very, very carefully selected. They go according to evidence-based guidelines. So when a vaccine comes out, it's not been researched on pregnant ladies, they don't give it to pregnant ladies. But the minute you get an okay from the manufacturer, then it's allowed for pregnant ladies. Same thing with the age groups. So the government has done absolutely a marvelous job in getting the right vaccines for the right people throughout. So I would give that a lot of credit as well.
Okay.
People have worn masks. Yes, we've also avoided them. But yes, that has been something to do in bringing the pandemic down. As far as the waves are concerned, you never know how the virus is going to behave. My initial, because I've been working with respiratory viruses from God knows when, we discovered the SARS virus before it was actually published by the West. We saw it was there. We published in the news. We discovered the MERS virus. We thought it's going to be there coming soon. And I presented to the Pakistan Chess Society. It did 6 months later, because you can tell the variants. But this is one virus which is not responding to any of the norms that you would expect for a virus to respond to.
Right. So your message to the public about keeping themselves healthy, keeping their immunity up, etc. How should they deal with this going forward?
Well, the first thing I would say that even with vaccinations, for God's sakes, don't think that you're perfectly safe.
Okay.
And the very simple example I give people is, when you're wearing a seatbelt in a car, it will not prevent the accident. It will not prevent you from killing someone else. All the seatbelt is going to do is save your life. That's what the vaccine does.
Okay.
It saves you from getting very seriously ill. It will save you from death other than what God has decided for you. But generally, it will reduce the severity of the illness. But if you're sitting with people who are infected, you can still transfer the virus to your children and to other people. So please wear your masks, continue washing your hands and sanitizing them, and maintaining social distance of at least, I would say, more than 6 feet.
Right. Okay.
So these are absolutely essentials, even after getting vaccinated.
Right. Thank you so much,
It's
Dr.
so grateful.
Yusuf, for being on our program today. A lot of wealth of information you've given to us and our viewers. So pleasure to have you on our program.
My pleasure entirely. Thank you very much.
Right. Thank you for joining us on Sky's the Limit. We were very fortunate to have with us today a leading specialist in asthma and allergies. He's in the top 1% of allergy specialists in the world and the top 4% of asthma specialists in the world, Dr. Mohammad Osman Yusuf. So we got a lot of good amount of advice about how to prevent asthma, how to deal with allergies, a lot of new methods that we may not have known about before, and also how to cope with COVID-19 going forward, because it doesn't seem like it's going away anytime very soon. So we hope that you benefited from this program. We'll see you next time on Sky's the Limit, same time, same place. And that's bye-bye for now from me.